written form. Today we focus on the very important topic of compression. As always, we will provide the international CME credits, and we will enjoy two stellar faculty members, Professor Chi and Professor Cavezzi. And we will enjoy also Then we move now to the second round, and if I had the pleasure of introducing Tesla before, now I will have the pleasure of introducing Guillermo Marconi. For the ones who are not familiar with the radio, Guillermo Marconi was the inventor of the radio, and he was from Bologna, where also Professor Cavezzi studied. So Professor Cavezzi needs no introduction. Like Marconi, is a big inventor. We are knowing him also for his experience with the long catheter. He's always into new things. Now he's all for nutrition and anti-aging, but we are looking forward for listening from a dear friend of many of us talking about adjustable compression reps, state-of-the-art and future direction. Attilio.
Thank you very much, Sergio. I'm sharing my screen. Okay, so I can start. So thanks for the kind invitation. I will speak about adjustable compression reps and the state of the art and future directions. This is my disclosure slide. As you can see, there is no specific interference in the material I present here. So what's the meaning of adjustable compression reps? Let's say we are moving to self-management within the healthcare systems. And this could be a political reason, but also a knowledge-driven move, let's say, because of ergonomics, and because we have to take care also of the issues that the COVID and the new health system are facing. So if we look at compression, everybody knows bandaging, but of course, sometimes bandaging can be difficult, as you can see in this case. So how could we help people who are interested in bandaging, or as nurses or as patients and so on? On one side, we have to keep in mind that compression pressure in bandaging does not depend on the device only, but it depends on several variables, such as the professional, of course, the material, the technique, and so on. So somehow we could say that there is a kind of midland between hosiery and bandages, and this is adjustable compression reps. This kind of adjustable inelastic garments has been proved useful for venous and lymphatic disease, and it is also a kind of an alternative device to bandages in general, especially useful for people who cannot wear stockings or just in combination with stockings. But especially, again, I reinforce the meaning, it could be a real option for self-management of the care of lymphatic and venous disease. So when we speak about adjustable compression wraps, there are a few models on the market. Still, we are waiting for more evidence, but what we know since the very beginning is that this kind of device may exert a very high interface pressure because of the composition of the tissue of this compression wraps. So a very high interface pressure, both, let's say, when walking or when standing, as you see from this slide from Giovanni Mosti. In this little summary, I tried to highlight how the adjustable compression wraps may have some advantages over stockings or over bandages. Because in terms of pressure, you may have some advantages, as you see here, which are similar to bandages. But when we talk about the maintenance of the pressure over time, and when we especially speak about cost saving and the possibility to involve the patient and not just the personnel, that's the question to choose probably the adjustable compression wraps. So if we look at literature, both Mosti and Parch demonstrated in this study how patients well educated to apply this device can reach a good pressure between 40 and 50 millimeters of mercury. And when they are asked to readjust, after 2 days, they keep the same pressure, or if not higher. In this elegant study from Protz, you can see a comparison between bandages and adjustable compression wraps, Circade in this case. And regrettably, bandaging reached only in 28.4% of the cases the targeted pressure, whereas the adjustable compression wraps reached the targeted pressure in 85% of the cases. And this is something to keep in mind because, of course, we are talking about a more standardized technique when dealing with the adjustable compression reps. Another study from Ugo Patch, which has been recently published, showed that during a course, an educational course, in the second course, after teaching, let's say, the self-application was tested, and there was a very high level, 61.5 millimeter of mercury, in, let's say, in the majority of the cases. So the pressure was absolutely around 50 to 60, as you see here, and never the appliers, let's say, went below 30 millimeter of mercury. So we tried as a group with Giovanni Mosti and Professor Pace to study, for example, in chronic edema. This is an article we published about 5 years ago in chronic edema. As you see here, we compare a bandage with the Cercade, and basically after 1 day and after 1 week, the edema reduction was higher, was better using Cercade in comparison to bandaging. And also when we look at the interface pressure, as you see here in supine position after the application and after 1 day, Cercade was able to keep the pressure at a good level, which was not the case of bandaging. And that's even more after 1 day or after an application when the patient is standing, as you see from this slide. Jean-Patrick Benigny and collaborators performed this study comparing the edema reduction, let's say using Cercade followed by Cercade, and you have still some edema reduction after the first intensive phase, which is not the case when you use stockings, 15 to 20 millimeter of mercury after a first cycle of Cercade. So again, this is something to keep in mind. Let's move now to lymphedema. Downstream Parch performed this very elegant study comparing compression bandaging with just a fit in this case. As you see, for example, in terms of leg volumes, let's say that after 2 hours and after 24 hours, the just a fit device achieved a better volume reduction in comparison, and this was statistically significant, in comparison to the trico bandage in this patient with the lower leg lymphedema. And measuring the interface pressure loss, that was higher for bandaging than for just a fit again. And again, they demonstrated a very good self-management of the pressure by the patient, as you can see here, and by the medical staff. So again, this is a possibility to keep in mind. In this study from Spain, they treated the breast cancer-related lymphedema, and it was a kind of non-inferiority study. And in fact, there was no significant difference regarding excess volume or symptoms between adjustable compression wraps and multi-layer compression bandage in this patient with the lymphedema of the upper limb. If we move now to ulcer treatment, you can see in this very old study from De Palma that treating patients with Cercade or with ulnar boots, they found a slight better trend toward faster healing for Cercade. Let's move now to Professor Villavicencio's group, and they published in 2005 another study comparing a 4-layer bandage with inelastic compression by means of Cercade adjustable compression wrap in the contralateral leg. And again, they found a faster healing rate when using adjustable compression wrap. So for ulcer healing, they found a better outcome with this device in comparison to the bandaging. So in this elegant review about adjustable Velcro wrap devices for venous ulceration, the author somehow highlighted the quite interesting outcomes, but they also highlighted some lack of evidence. So somehow potential benefits for adjustable compression wraps were highlighted in terms of cost, nursing time, patient satisfaction, and potentially ulcer healing. They advocated some more studies to give more strength to their recommendation. And the musketeer Giovanni Mosti replied, giving more evidence, let's say. And so they performed, Giovanni Mosti and collaborators, the Miracle trial. They performed a multi-center Italian randomized clinical trial. And basically, they compared Cercade Just a Cure with a multi-layer bandage, Coban 2, on a total of 66 patients affected by venous ulcer of the lower leg. During the 3 months trial, there was a classical local medication, followed by Circade in one group and followed by Coban 2L in another group. Of course, in the Circade group, the patients themselves readjusted the pressure when needed. On the contrary, in the bandaging group, there was the collaboration of nurses or doctors. So the results, in terms of healing rate and ulcer surface area, you see it was slightly better for Circade in comparison to Coban 2 layers, though the difference was not statistically significant. And when we look on the contrary to the material cost, this was clearly in favor of Circade in comparison to the bandaging. As you can see, a fixed cost for Circade is lower, statistically significant lower, when compared to the costs that the patients, or well, let's say the staff, had to cover for treating the patient in those 3 months. And I want to stress one point, that in this calculation, they did not include the cost savings derived from self-treatment. I mean, there was no caregiver in the adjustable compression reps group, which is another issue to keep in mind. The interface pressure and stiffness, as you can see, were similar in terms of interface pressure. And it was at the removal, of course, better for Circade than for Coban, as you can see here. In terms of comforts and side effects, let's say that slightly better outcomes were achieved through Circade, though the difference was not statistically significant. So in this study, a few very simple conclusions were that the adjustable compression reps were effective in comparison to inelastic bandages, very similar or if not better outcomes. There were no specific unwanted effects, and self-management was something very important which was highlighted because patients could help with the treatment, and that was an extremely important issue in terms of cost savings. More recently, in terms of COVID-19, there was an expert opinion article from our Turkish friends, and somehow everybody knows that with COVID-19, we have to shift from professional caregiver-based therapy to self-management. And that's why their recommendation was that we could shift from bandages to compression garments, or better to adjustable compression reps to treat especially venous ulcers. So going to nearly to the end, this is another interesting study from Poland where adjustable compression wraps were applied to a post-thrombotic limb, and through magnetic resonance, they were able to demonstrate that when through this device you overcome the pressure of 40 millimeters of mercury, then you can significantly improve the blood flow, which is an option in post-thrombotic patients, even also probably in DVT, but we are waiting for some data, and I know that some studies are coming. So I also found this nice letter to the editor from Kajati and Mander, where they evaluated the changes in ankle range of motion and plantar load with different compression devices. Basically, they highlighted that the higher the compression on the foot, the ankle, the greater the reduction of this ankle. So to make it short, they suggested possibly applying, for example, just a fit without the underlying elastic ankle would allow to have a nearly normal ambulation, and probably, as boropodometry did not change, could be a sign of a good function of the leg pump. So in conclusion, adjustable compression reps are a safe and effective device which can be used to treat venous and lymphatic disease and does not require expert personnel, which is something to keep in mind. Both ulcer healing rate, edema, and lymphedema can be treated with significant success by means of this device, which is well tolerated. And again, the cost saving is another proven feature of this medical device. That's why it could have a real role for the future. So I sincerely thank both Ugo, Giovanni, and Robert Damson for their help during my presentation. Thank you very much.
Thank you to you, Attilio. Wonderful talk. I ask for allowing my screen sharing, Khaled. So please allow me to get to our continental top experts. So we have Attilio has to stop his sharing. And if Khaled, thank you. And then we can move now to our World Scientific Round. We will start from Latin America. And it is my true pleasure to introduce Eduardo D'Amata and also congratulate him because he has just been elected Scientific Secretary of the ICC. He's a huge expert in compression, so we welcome his question. Eduardo? Eduardo, are you with us? You have to unmute yourself.
Yes, okay. Thank you, Sergio, for the invitation. Attilio, congratulations for your presentation, too clear as always. And as you know, we are working in the CIRCADE trial using the CIRCADE, the Velcro device in the acute phase of deep venous thrombosis and in order to prevent post-thrombotic syndrome during a long period, during a year, using this strong compression. And concerning to the fact that we need high pressure of compression, more than 60 millimeters of mercury to neutralize ambulatory venous hypertension. And you showed us that it's possible to get with Velcro device. My question is, do you think we will see in our trial a decrease in the incidence of post-thrombotic syndrome with the use of Velcro device for a long period, a year in this case?
Well, you should give us the reply when you have the data. Let's say we expect that when enhancing the recanalization, we can also increase and improve the final outcomes, because post-thrombotic syndrome is due for sure to what happens into the veins. But what we know that it's also due especially to the pump, let's say how the patient goes after the DVT. So on one side, we expect that higher pressure will give a better post-thrombotic, let's say, course, but I have no specific data on this to tell you. Maybe Giovanni may know a little bit more, let's say.
Okay, we will have time later on for Giovanni during the honorary chair, and then we move on the way to Europe, and it's my pleasure to pass the mic to Oscar to introduce our friend Gerardo. Oscar?
Thank you. Let me introduce Dr. Jaroslav Stracek, head of the Czech Society of Phlebology. Doctor?
You have to unmute yourself, Gerardo.
Gerardo.
Unmute yourself. We will go back to Jaroslav later on if there are like some technical issues. So I pass the mic now to Willie to fly all the way to Africa for somebody we all know and appreciate so much. Willie?
Yeah, next we have Professor Wasila Taha, who's the head of Egyptian Egypt Africa Venous Lymphatic Society, and really we call her the Cleopatra of phlebiology.
Hello, everybody. Confirm that you can hear me, yeah?
Yes. Perfect.
Hello, everybody. I'm really honored to be part of such distinguished scientific event and with a humanitarian perspective as well. Let me congratulate you, Willie, first for your excellent presentation. And now for Dr. Cavezzi, excellent presentation as usual. And I wish to see this opportunity to thank you very much for all you have done in our society in Egypt, really very early in this century on behalf of our Egyptian vascular community. You bring us all your experience, your expertise and knowledge about the modern vein therapies very early in this century. We're really very grateful to you, Dr. Cavezzi. Now my question, I have been inspired by the title of your presentation, Attilio, and future directions. I wish that if you can highlight the role of the intelligent compression wrap with the microprocessors, with the sensors, with the compressible bodies embedded inside, and if you can add a real value to the conventional adjustable compression wraps. Maybe if your positive reply, maybe which candidate would benefit from such new technology? Thank you, Attilio.
You mean which technology? Can you repeat just for a second?
The intelligent compression wrap with the microprocessors and sensors embedded inside the conventional ones.
Well, I mean, measuring is always interesting. So we have some possibility to measure, and even recently I saw photoplethysmography and during walking, dynamic, let's say, plethysmography, which would be interesting. Sorry, normal plethysmography during walking. But apart from this, I think it could be interesting for scientific purposes. Of course, we have some chances. And Giovanni Mosti and Ugo Pasch always stress the point that if you do not measure the pressure, then you should not perform any study because it's a dose of a drug, let's say. So from the scientific point of view, for sure.
It is great. Let's try to fly back to Europe. Oscar, can you introduce our continental expert representative? Unmute yourself, Oscar. Okay.
Again, let me introduce Jaroslav Stracek. Now, está or not?
Yes, he told me it's there.
Yes, I should be on.
Yes. Gerardo, please speak.
Oh, thank you very much.
Here we are.
Dear Professor Gianessini, dear Sergio, he's speaking your friend Gerardo, Jaroslav. I'm very happy to be here as a participant of this fantastic program in this very heavy period of the Earth, because we have a difficult time. So that's, you know, but we are very happy to have you here. Decompression is one of the most important activities in phlebology. So I understand that there are many trials to get a good compression to the patients. From my point of view, is to give the patient a compression tool suitable for his type of disorder, then to enable a self-service use, and then to have the option of individual adjustment of size and the change of size while the swelling edema reduces. So in my clinic, we have a little museum of phlebology. So we have very interesting things here. This is also an adjustable tool. We have another one here with a zip. And we also have a circuit here. So I will go to my questions. This is the self-service use, which is a little discutable in our hands because in our unpublished study, we have achieved a success of application.
Please compare.
Please, Gerardo, go on.
Is there any problem?
No. It was Oscar having a Giovanni Mosti moment. Okay.
Okay. So once more, we did a little study for us. How is the compliance high? My medical personnel was trained in applying the ACV on their own legs, and they succeed in 37%. When they applied it on the patients, they succeed in 55%. But the well-instructed patients, they succeed only in 17%. So we measured it very exactly in 4 points with a device, 4-channel, measuring the pressure in the ankle region and getting up to the knee. And what is not only to reach a compression at the ankle region, but to reduce the pressure to the knee to 70%. So this is my question. What I would like to ask is how the higher success of application has been reached in the other clinical departments than what have been mentioned here. And has my clinic been too strict in assessing the success of the application, measuring the graduated compression? Thank you.
Thank you, Gerardo.
Jaroslav, the question is that the teaching, an educational course to the patient, of course, to the nurses and to the doctors as well, but to the patient is mandatory. My own experience is that once the patient knows what to do, you have also a kind of regulator in the device, at least. I don't want to make any specific advertisement, but we have also a regulator which helps you to keep the pressure. And the patients are happy, as you told me, about the possibility to readjust when needed. So in my experience, we achieved very good, let's say, reliability of the final outcome of the final pressure through this device. Of course, it depends on a good education on the patients.
Yeah.
Generally speaking, I would say it's a major advancement for the involvement of the patient, especially when you can standardize the way you put the straps.
Yeah.
Thank you so much. Thank you so much, Attilio. And now we fly all the way to Mexico for introducing our continental expert representative. It's my true pleasure to introduce Fernando Vega from the Tournai College of Phlebology. Fernando.
Hello, friends. Thank you, Dr. Sergio. Thank you for the kind invitation. Thank you, Dr. Attilio, for his excellent presentation. It's an honor to participate with you, that you are a great scientist in different areas. My question is, you have demonstrated the big qualities of the Velcro system. Sometimes applying the multi-layer bandage except the compression and cause injuries on an ulcer when this was known, especially in the flexion fold of the ankle. Has this happened with Velcro system in this part or in other place of the leg?
Well, personally, I had no specific injuries. Basically, the Velcro device stops at the level of the ankle, and you can or you can't include a foot part of the Velcro device. It's up to you. Otherwise, you have a sub-Velcro device, little stocking. So personally, I had no specific issues on injury. Of course, it depends on the pressure you use, but generally speaking, this was not an issue in my experience and also in Mosti and others' experience.
Thank you very much.
Thank you, Fernando. Thank you, Attilio. Attilio, now we move to the question and answer box, and we go back to Fabricio Jordan Santiago. Do you think it's necessary to know which interface pressure the device is giving during its use is meaning the adjustable compression rep, especially when considering its use in arterial patients?
Well, yes, when you use any compression, you should know, first of all, which is the condition of the arterial system, generally speaking, but that's not my topic today. So once you decide which pressure you want to apply, you can, on one side, have the help of the regulator, again, which helps you how to put the straps. And then if you may measure the pressure, such as a picometer or whatever, then you are on a safer side when treating peripheral arterial obliterating disease patients. But generally speaking, this is a stiff device, so there is a very low rest pressure and very high working pressure, which is a little bit reassuring, let's say, also in case of arterial patients, when they are not in a critical limb state, of course.
Great. So we have once again Professor Rashad Bishara is asking you, how do you handle venous ulcers which are located distant to the adjustable compression rep?
Sorry, can you repeat the endothelium?
How do you handle an ulcer that is located distal to the application of the rep?
Yeah, I mean, again, when you use this kind of a device, you can use the foot part, which includes, of course, also the ankle part and so on and so on. And so in the case of ulcer, this could be an option. But again, you have anyway stocking, which is exerting some pressure on the ulcer area on one side. And the major effect of the circade of adjustable compression rep is on the calf muscle pump, which is, of course, the most important effect we look for when treating venous ulcer. But I reassure that we can use in venous ulcer, especially including the distal part, and also through the stocking, which is under the circade.
And it's my pleasure now to introduce the question from Lowell Kabnik, needs no introduction, a pillar also of this project. So thank you also for having an honorary chair of one of our webinars. He's asking us something that is actually really dear to me and Erika Menegatti. With the advancement and understanding compression, where are we with hydrocompression?
Hydro?
Yes, it means water. As you know, like publications.
With Giovanni Mosti, he can reply again also to this question because they are working, and I know that also you, Sergio, are working on this kind of possibility. So that's an option, of course. I mean, it's a different compression because you are working on the neural fibers in that case, which is another interesting effect on the autonomous neural system, not only exerting a compression, but also working on the microcirculatory and neural effect. But I can't add more on the water immersion compression, which is an interesting point, of course.
Now the next question is about the progressive compression, Attilio. So thank you for your nice presentation. What is your opinion about the progressive compression? So when there is pressure that is increasing from the foot to the knee.
I mean, we have two kinds of compression. One is decreasing towards the heart, and also there was some articles again by Giovanni Mosti and Parch where they studied the compression which was slightly higher in the calf than in the ankle, and they demonstrated that it was also an interesting concept, provided that you do not create any tourniquet, let's say. So let's say that adjustable compression wraps somehow mimic what they propose, and again what Caggiati wrote in that letter was showing as an option that also the foot could move better when you are not compressing too strong and reducing the normal gait, let's say.
So we are getting now a question from Juan José Vargas Carrasco. If I understand exactly what he's meaning, he's writing, is the leg compression a prophylactic care? Because COVID is a viral, inflammatory, and thrombotic ill. The pulmonary ground is in situ. Maybe what he wants to ask is if there is like some prophylactic action of this kind of compression.
Well, this is not a device created for prophylaxis, of course, because it may achieve a very high pressure, which are not needed as prophylaxis. And again, we have no data. I can't say anything more, especially in COVID patients or in any other issues. Let's say post-operative use, that's another story. We have done it. It could be an option because of the high pressure you may achieve, especially in the thigh, where that's not so easy with traditional compression devices.
And then we have a question from José Salas. I try to translate in from Spanish. In case there is an inflammatory lesion of the skin and there is an exudative ulcer, what would be the most effective compression methods according to your experience, Attilio?
Well, in terms of exudative ulcer, you may use all the local treatment you need, and then you can choose between a bandage and a compression stocking or an adjustable compression device. Of course, stocking would have some problems more, let's say, because of the fluid which comes out. So again, this kind of device, the adjustable compression wraps and bandages, could have an option, could be an option for sure. We need probably some more eccentric compression and some more material over the ulcer when there is such an exudation.
And then always José Salas is asking us in Spanish, what is the influence on the deambulation when we are using circade compression?
Well, there were a few slides where I clearly showed how the pressure increases during walking, and that's good because we can combat ambulatory venous hypertension well through this device, which could not be the case with the traditional stockings, especially when you have a very severe post-thrombotic syndrome, for example. So what we expect, as it is a stiff and low elasticity or no elasticity device, we expect a significant improvement of the hemodynamics with this device.
And since we have still a couple of minutes and we have answered to all the questions, I would ask you guys, Attilio and Willy, considering your expertise and particularly the one of Willy on interface pressure measurement device, how much can we or should we rely on the evidence-based data we have in compression, and how much we should also weight the risk-benefit in compression that is, of course, favoring the benefit because it's not so risky, comparing to the fact that in the literature, a lot of time we don't have a report of interface pressure in B and in B1. And it was demonstrated by Rothen that you can have the same interface pressure on the skin and a 50% variation in the subcutaneous pressure. So could you comment on this aspect between empiricism and evidence-based in compression science? Starting maybe from Willy with his experience with interface pressure measurement devices.
Yes, so that's a great question. So from our standpoint, as many of you maybe saw my work published in Phlebology and other journals, that we have been looking at various methods of detecting interface pressure or measuring interface pressure. But I think that we still have an issue with the sensor or the type of sensor that we need to do this. From piezoelectric and other form of sensing mechanism, and that has not been solved yet. So I think that until we have the actual device or the sensor being deemed to be sort of the standard, that is the first thing we'll have to do before we start to, let's say, for example, use interface pressure as some type of tools that we can move forward with different type of device measurements. So again, going back to what I said, I think that we're still not there yet as far as the sensing, as far as the sensor is concerned.
Thank you, Willie. Attilio, do you have a comment?
Well, very simply, what we need is to know the pressure. So whatever you do, I would suggest, I would recommend to measure the pressure. And for the single individual, that would be reliable because it's the same device. Of course, if we talk about different devices, we might have different pressure, but anyway, we need to measure the pressure when performing especially scientific studies.